Hi, this is Dr. Nigel Brayer. Today we're going to talk about a case study. As I've mentioned many times before, I've been in practice for over 28 years. I've seen a lot of different very interesting things, but I've had a lot more patients who come to see me with bladder issues, but also they talk to me about their children. I've seen so many children the last probably year and a half with chronic what's called nocturnal enuresis, which means bedwetting. Now, we'd think of that as pretty common in the younger ages, but we've been meeting children that are 11, 12, 14, 15 years old with chronic bladder issues and inability to hold their urine. So what we've been doing is a lot of really deep diving into what's the neurological components of these conditions. So when you understand how the bladder works, you understand how the valves work and the tissues around it. When it comes to children, generally their anatomy and physiology are very on par for what we expect. Adults, they'll have trauma, they'll have hormone changes, they'll have birth, they'll have scar tissue. When it comes to children, it's a whole different can of worms because it's almost exclusively neurological based. So if we want to address a child's bladder issues, we always have to dive deep into what's called functional medicine. Now, we do this with adults also, but with adults and children is the whole system affects the nervous system. The nervous system is what's going to control and allow the proper function of the bladder. So it really stems back into the gastrointestinal tract, the GI tract. We look into things what are called leaky gut. We look into what's called sympathetic dominance. So with a child is, of course, their body is just like ours. We're training, we're learning how to improve function, but the nervous system unconsciously has a huge impact, especially at night, when the child is sleeping or relaxing because those neural pathways are being affected. So we have to look at the stressors that are going to affect the nervous system. So this applies to adults and children, but we've seen so many more children that I didn't see 15 or 20 years ago, simply because we have so many different things affecting us now. We've got chemicals, we have toxins, we have children being exposed to things that I have to be honest, they're just not equipped to handle. So when it comes to addressing the bladder, we also want to be mindful that this affects our children too. If you want more information on how to help your children and help their child's bladder, just go on our website, simply set up a time for you and I to talk, and we can get some general information and give you some guidance. Till next time, we'll talk to you soon. Thank you.